Today on the show, the first of a series of episodes featuring clinicians from ACCC's first global panel discussion at the 41st National Oncology Conference in October 2024. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, we discuss the challenges faced by patients with cancer across the globe and how our healthcare system can learn from their experiences. Dr. Enrique Soto joins us from the University of Colorado Cancer Center.
Patients are worried about getting high-quality care. Patients are worried about the impact this will have on their families. Patients are worried about transportation. Patients are worried about the financial toxicity of treatment. Also, of course, about actual physical toxicities of treatment. But, people are the same everywhere, right? And the concerns people have are very similar. And I do think that we are all, in all our healthcare systems, we're working with limited resources. So I think a common challenge and a common solution for the world is how to better steward those resources to actually help the populations that we are offering care to get access to high quality care in an easier fashion and with less toxicity in any way you want to define it, right? Toxicity for them, for their families, for their time, for their money, etc.
Dr. Soto, you've worked with underserved populations in both Mexico and the U.S. What have those experiences taught you?
So I think that one of the main barriers for underserved populations accessing the healthcare system is insurance, and coverage, and also the fact that in many cases, the places that provide that coverage, that provide insurance, are not close to their home, right? So in Mexico, for instance, patients have to travel to large population centers in order to get cancer care. And the same happens in the US, right? Now that I'm working in Denver, I get patients from Wyoming, from Kansas, etc., who have to drive hours and hours to get to the University of Colorado Cancer Center. So I think that we all should learn about how to improve access to care, to basic oncology care, and also to other things like clinical trials close to the patient's home, extending our reach into the community.
How has your practice changed since you moved to Colorado to serve patients?
So it's actually very, very heartwarming for me to see that many patients that I see in the US are exactly like the patients I would be seeing in Mexico. And in fact, a lot of them go to Mexico for extended periods of time to be at home. Many patients come to the US because they know that healthcare here is better or maybe better, more access to medications, etc. But when you ask them what they want to do or where they would prefer to be, many of them would prefer to be in Mexico at home. And so I think that for very multicultural countries like the US, where people come from all over the world and bring their languages, their culture, etc., I think that understanding that, adapting to that, and making sure that we are providing people with care that has cultural humility, that includes the values and the culture and the things that matter to patients, I think that is super important. And that's one of the things that surprised me about working in the US, that for a part of my day, I'm working in Mexico, another part of my day, I'm working in Russia, another part of my day, I'm working in Ethiopia, because that's what we should try to do, right? Provide patients with care that is personalized to them, right? Just as we personalize care to tumors, we should also personalize care to patients, their values, their family, their culture, etc.
How can the U.S. learn from other countries?
I do believe that countries like the United States and other high-income countries are widely spending money and resources, in many cases in things that are unnecessary, redundant, or of very low actual benefit for patients. And I think that rethinking what's important, what's essential, is another global challenge. And I do think that high-income countries, such as the US and others, could learn from models that are working in low and middle-income countries in which things are being done by a fraction of the cost with very similar results, right? The fact that things may be simpler or cheaper or less sexy does not mean that they are less effective or have worse outcomes. And that is a concept I really love, which is a concept of reverse innovation. Things that are done in lower resource settings with simpler methods, less complicated, less expensive, and then those trickle up to high-income countries.
Thank you, Dr. Soto. We'll share more global perspectives on this channel in the coming weeks. Follow now so you don't miss a thing. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.